Welcome back to MedCity FemFwd. I'm Marissa Plescia, reporter for MedCity News. In this episode, we're joined by Dr. Cathleen Brown, medical director at Winona, a telehealth company for menopause. We discuss the company's new initiative that aims to expand research for menopause in women's health. Hi, Dr. Brown. Thanks so much for joining MedCity FemFwd.
Thank you so much for having me. I love having these conversations, so it's nice to be invited on.
Yeah, absolutely. Maybe just to start, can you tell me a little bit about yourself and what brought you to Winona?
Sure. So I am a board certified OBGYN who's been practicing since I graduated residency in 2008. What brought me to Winona was that I started going through my own struggles in midlife and dealing with symptoms of perimenopause. And I was actually approached when Winona was looking to expand. When they first started out during COVID, that's when we were born, in the age of telemedicine, when we realized that in a global pandemic, that was one of the best things that came out of that was knowing that we could improve access to care for patients through telemedicine when it wasn't safe to go into offices. And there was a real gap in care being provided to women in midlife. And so they started in California and Texas. And then when they were looking to expand to Pennsylvania, they reached out to me because our chief medical officer and I both worked for the same company providing like OB laborist backup to hospitals. And so at the same time, I was also doing a deep dive and really trying to find better care for myself because I was going through so many symptoms and being told I was too young and being told that, it wasn't time yet. I needed to wait till I was suffering more before I got treatment. And so as an OBGYN, many of us and any doctor really, we don't get a lot of training in our medical school years or even in residency. So much of the focus is placed on fertility and pregnancy and, period management and treatment of other GYN disorders. But there wasn't a lot of emphasis placed on taking care of women in midlife and beyond, which is where we spend the bulk of our years as women. So I was really excited to join the workforce to help take care of patients, but also, I had a vested interest because I was one of those patients as well, also going through a lot of the symptoms.
Yeah, thank you so much for sharing that. And I think that flows great into what we're talking about today, which is the Winona Research Institute, which you just launched. Can you just talk a little bit about what this is and why you launched it?
Yes. Yeah. So, in women's health, globally, this has been an ongoing issue is that not a lot of emphasis and time or money is spent putting money into helping making women's lives better. Even birth control pill, the research done on birth control pills wasn't actually, used and researched on women themselves because so many researchers and scientists felt like the women's hormones were too variable and throughout the different times of the month that there were too many confounding variables. And so for a long time, women weren't even included in research trials. And this, has been a pervasive thing in medical research for decades, for years. And now we're really seeing that there's a need and there's a huge gap in getting the information that we need to reliably be able to take care of patients safely. And so because of that gap, Winona feels really strong. Like one of our real, founding, tenets that we like to do is like really to provide a lot of education. Even if patients aren't our patients, we want to help spread knowledge and information so that women can be empowered to better care of themselves. And we really feel like the research initiative really goes along with that too, because we feel like it's our duty to kind of help to contribute to research that could improve women's lives and improve women's health overall, so that we can get the information we need. And this is not something that's just unique to us. There have been research dollars just recently donated to the Menopause Society as well to try to improve women's health research as well. So, there's a recognized gap as far as the information that we need. And there's so much more research that needs to be done so that we can continue to enhance the lives of women as they go forward into midlife and beyond. So that's really why we really want to help, fund research projects that can help make lives better for women.
Yeah, so well said. So what's your process for selecting scholars and what kind of support do they get?
Yeah. So right now in the early phases of this research initiative, we're looking for scholars, whether they be medical students, residents, or even early career physicians who maybe already have a project in mind, have already started, but just need money to kind of help get the process going so that they can get their research, presented at a meeting, especially, because that's really when the data really, helps to make change in healthcare is when you take research and you present it to other doctors. It's peer reviewed. And then we can determine whether or not, the research is quality and also can help to change practice is really the goal. So we're looking for people that already have a project in mind or have a goal of what they want to study. And they're just looking for, someone to help back them to kind of help make that process happen. And so that's really our goal. And so, not patients, the scholars that are interested basically submit their information, submit their theories on the project, their, the hypothesis that they're working on for their research project. And those are reviewed on a rolling basis. And so the goal is to try to get a few scholars every few months that we can be actively mentoring and help them with, finishing a project and getting it presented at a scientific meeting.
And how is this all funded?
Well, it's funded from our Winona company. So, basically, we've set aside a core amount of dollars that, that we're starting this project with. And so it's really from the profits of the company. And that may change and morph over time, depending on what our outcome is from this research initiative. The goal would be, to help improve the dialogue of more people wanting to do women's health research. And we would love to be able to contribute to some really meaningful menopause related research. But for right now, we're not narrowing that to just menopause related care. It's really anybody trying to do a project to further women's health, because we feel like that's important globally, is to improve women's health care.
Absolutely. Earlier, you talked a little bit about your experience when you were a medical student, about how little training you received on issues like menopause and other women's health issues. Can you just talk a little bit more about that and how you hope something
Absolutely.
like this changes that?
Yeah, absolutely. So in medical school, for those that don't know, someone who's gone through it, the first 2 years of medical school are didactic and are in the classroom. And the second 2 years are clinical, where each month we're basically doing clinical rotations in a different subtopic of medicine. So one month you do cardiology, and next month you do pulmonology, family medicine. So in the first 2 years, we have the core OBGYN lecture, which is several months long. And they have to cover everything that there is to know about OBGYN in that time frame. And so I think maybe we got 1 hour or two about menopause and after. A lot of the other things, the other time was spent on learning the menstrual cycle, learning medications, because we have to learn the pharmacology, we have to learn the physiology, the anatomy, all of those things when you're learning each system. And then in residency, so when you become an OBGYN resident, that's to be able to be a board certified OBGYN after you sit for your board exams, after your training. The residency for OBGYN is 4 years. So much of that, especially in the early years of your residency training, is spent on obstetrics and fertility and like menstrual management, contraception, dealing, helping patients deal with heavy periods or, anatomic issues like fibroids, endometriosis, things like that. And I remember, certainly getting maybe a couple hours about menopause care. And when we were in residency training, every year we had to take in-service exams, which is when the program that's training you really can see, if their training program is giving you the adequate knowledge that you need in order to be a board certified OBGYN at the end. So you take this yearly exam. And so I remember our attendings teaching us, oh, well, you need to learn this stuff about HRT for your shelf exam, for your in-service exam, but you're never going to use this, because when I was training, it was right on the cusp and the heels of that Women's Health Initiative study being out in the media. And that really caused a global widespread fear of hormone therapy, and reflexively caused a lot of doctors to take all their patients off hormones, because everyone was so deathly afraid of, hormone therapy causing breast cancer, causing heart problems. And we've learned so much from the Women's Health Initiative study. We learned good and bad. But what was really bad was back then they took that research study and it rolled through the media, big headlines, and it caused this widespread panic that has been pervasive ever since. And it's still to this day that, the outcomes and the stigma of HRT from that study that was on the news has really caused a lot of women and a lot of physicians to be very afraid of, learning more about this treatment option and offering it to patients. So, I mean, we're at the point now where the tide is changing and women are demanding better, especially women like me who are female OBGYNs going through it themselves are demanding better care for patients. And women are speaking up. They're being those squeaky wheels, demanding better care. And so I think what's going to happen is it's going to drive that education process better. And we hope that the pendulum's going to swing so that more menopause related care is infused into the curriculum of doctors moving forward. I mean, ultimately, if doctors don't get on board and then they have a large proportion of their patients that are females 40 or older, if they're not comfortable with managing menopause and they're not comfortable with discussing hormone therapy, the patients are going to go elsewhere, right? So the patients and as consumers are really going to drive, I think, this education change. But also it takes, research funding, it takes dollars to kind of help get curriculums changed and to provide the support to medical schools and residencies so that they can infuse this into the curriculum better so that, future OBGYNs that are graduating and future family medicine doctors and internal medicine will get more experience and more of a comfort level with treating patients that are going through perimenopause and menopause. And that's really the goal because it's been too far and few between that, doctors feel comfortable with it. You really have to have the experience to feel comfortable.
So well said. We actually talk a lot about that study and HRT and how that's changing in our last episode. So thank you for bringing that up.
That's
Yeah.
great.
Yeah. Well, going off of that, you also recently released a new report on the state of menopause today. What were some of the key findings of that report?
Yeah, I mean, so we really have a nice, data bank of patients. We've been in practice at Winona since 2021, and so we felt like it was important for us to release some of the information that we have learned through taking care of thousands of patients through the Winona platform. And what we've really found that, by the time women get to us, they've gone to several different doctors before they get the help that they need, and that's kind of universal that a lot of women are getting that closed door, they're getting the no, they're being told it's a natural process that they need to suffer. The other thing that we're noticing and that we put in that white paper too is that women that are seeking care are reporting an average of like 9 or more symptoms at once. It's not just, simple hot flashes and night sweats. This is multifactorial, so many things that are affecting women's lives. So specifically like energy loss, weight gain, fatigue, brain fog is a big one. A lot of women are starting to notice the effects of hormonal changes on their day-to-day schedule, their work life, their home life, their relationships. And one of the biggest problems I see in all my patients is sleep issues, especially. And most women, it takes them a while to seek the care that they need. So a lot of women were dealing with symptoms for at least a year before they found the care that they need. And a lot of women describe like 1 to 3 years of suffering from symptoms before they find somebody who's willing to help them. So those are some of the big things that we found when we looked at our database of patients. Um, and also, for women that, have had prior hormone therapy, they can sometimes have symptoms for longer duration and have, an overall burden. So some women experience all the changes and symptoms of perimenopause and menopause much longer than others. And so we're seeing those kind of patterns. And we wanted to share this information with other people out there. We wanted to especially share it with patients. So it's available for everyone to read so that they can kind of learn where they kind of fit into that overall, spectrum of patients too.
Yeah, thank you for sharing those findings. And just one last question for you. Based on some of those findings, what more do you want to see in the industry to improve menopause care?
I really want, I mean, at a baseline, even if healthcare providers, doctors, nurse practitioners, PAs don't feel comfortable with menopause care, like even if they don't have the experience managing hormone therapy, I just want people to be open to having the conversation. I want people to listen to women. I mean, I think that's the most important thing. And unfortunately, there's some systemic issues in our healthcare system too that limit the ability of a doctor or another type of healthcare practitioner to really spend quality time with their patients. But I also want more of the in-person doctors and, medical systems to be open to allowing the infusion of telemedicine as a way to kind of help balance the in-person care too. So, we have the luxury of being able to spend a little bit more time per patient than those like 10, 20-minute visits when you're kind of rolling through and trying to get your insurance reimbursement. And so really, I think that telemedicine can be very complementary to in-person care. But also, I think it's important for women to recognize that telemedicine cannot replace your in-person care. You have to do both because we can't examine you through the computer. That's just impossible. You still need your well woman care. You still need breast exams, pelvic exams, pap smears if you still have the cervix. So I think those are the important things that I want people to learn is that, yes, telemedicine can help, but you need both. And I just want more people to have the conversation and women to have more access. Access to care is really the biggest piece of this.
Yeah, so well said there. Well, Dr. Brown, this has been such an interesting conversation. Thank you so much for joining MedCity Come Forward.
Well, thank you so much for having me. It was great having this conversation.